My name is Wendy Smith, and I'm an oncology nurse practitioner from Mississippi. The question I have, or concern that I want to express, is why does our current administration and the Democratic majority in Congress, as well as much of our media, feel that a government-run healthcare program is the solution to our healthcare crisis, when we have Medicare and Medicaid as prime examples of failed government programs, Medicare on a federal level and Medicaid on a state level? About 84% of the cancer care that is provided in this country is provided in the community-based practices. That's almost 6 out of 7 cancer patients are treated in community programs. These community-based practices are essentially small businesses. Since the Medicare Modernization Act of 2004, community-based oncology has had about a 25% reduction in Medicare reimbursement. Much of the decisions that were made in arriving at these reductions was based on dated data, small samples, and samples that did not break out different medical specialties. I don't believe that our legislators or our current administration understand the complexity of cancer care and what it takes to administer this care in the community. The Community Oncology Alliance has commissioned Avalier Health to perform a study that looked at all levels of the practice, the complexity involved in cancer care in the community. The survey was reviewed and evaluated not just by physicians, but by physicians, nurses, administrators, and pharmacists, people who truly reflect the team of community-based oncology. And since the study began between April of this year and August of this year, we have found that in 2009 alone, we were experiencing a 55% reduction in Medicare reimbursement. Now, again, I want to stress that these are small practices. What's happening is that many of the practices in rural communities are looking at having to close their doors. Larger practices that have satellites are having to consolidate. We're making drastic reductions everywhere that we can, including staffing. And these cuts don't take into consideration that we are also providing care for the uninsured, the non-payers, and many third-party payers. Private insurers are following Medicare's example. Small businesses, small community practices, we cannot sustain this access to care. When I started in oncology over 25 years ago, patients had to travel 1 to 2 hours sometimes to get care at comprehensive centers. But since that time, we have translated excellent care back to our communities. People don't have to travel to the major cities or cancer centers anymore. We can deliver care with the highest standards, excellence in care. But with all these cuts, this access is being hindered. The doors are closing. We can't sustain this quality of care. And taking consideration also that we have an aging population, we have an increase in cancer incidence, and people are living longer with cancer. At the same time as we're having these cuts. What needs to happen is we need to get outside the beltway mentality, into the trenches, work with those of us who are at the bedside, work with those of us who are in the trenches, bring the patients, the physicians, the administrators, the pharmacists, the nurses, the insurers, and Medicare, CMS to the table, and do some creative brainstorming. Our own president said, fix what is broken and build on what works. These community-based practices have been successful in the past. We need to be heard, and we need to work with CMS and third-party payers. The solution is not in Washington. The government programs are not working.